Do you sometimes feel incompetent when trying to communicate with patients who have aphasia? This video will tell you all you need to know about dealing with people with aphasia, giving the main points to look out for, and communication strategies and tools. Aphasia is a language disorder, often caused by stroke or brain injury. It affects speech, comprehension, reading and writing, but not intelligence. Their difficulties in understanding or producing language make navigating healthcare difficult at every step. Accessibility for patients with aphasia is not simply a need, but an entitlement by law. Additionally, also for you, the medical staff, it's nice to have more structured approaches when dealing with patients with aphasia. For the future, if you see the symbol, that means that someone who has aphasia is present. So there are three main things to take into account. 1. Communicate, include the patient. 2. Practical tools and strategies. 3. No one size fits all, everyone is different. Ask the patient what works for them. Some may bring an aphasia card or prefer written support. If a caregiver is present, only involve them with the patient's consent. Here are some small changes that can make a big impact. Speak slowly and clearly. Give your words time to land. For example, instead of rushing through instructions, slow it down. We will do a blood test. Use short sentences, emphasize key words. Keep it simple, stress the important parts, like, your appointment is tomorrow at 10 o'clock. Avoid complicated phrasing. Say one thing at a time. Instead of, do you want coffee or tea? Try, do you want coffee? Then ask, do you want tea? Ask yes or no questions to check understanding. Open questions can be hard to answer. Try yes, no instead. Are you in pain? Does your shoulder hurt? Does your elbow hurt? Use gestures, drawings, or write down keywords. Draw or write. A simple sketch or a few keywords can go a long way. You can also point to what you're talking about. For instance, if you're asking them to take a medication, you could point at a pill. Important information you can write down. Treat your patient with respect, always. Overall, remember that people with aphasia are adults. Avoid speaking in a childish tone. Just speak clearly and with respect. Also listen respectfully. Be patient and do not cut off the patient. Sometimes you just don't understand each other, and that's okay. You can always say you don't understand them at this moment. You and the patient could keep trying different strategies. Keep in mind that the patient might already know what strategies work best for them. Next to communication strategies, several tools can be adopted to improve communication for people with aphasia. Again, patients might already use some of these and bring them to the appointment. You might prepare tools yourself that are adapted to the medical setting. For instance, you can use apps like Lees Simple, which simplify written documents using AI, or Hello Aphasia and Spraakassistent for communication support. This is so you can support and advise if requested. You could also print out iconographs of medical topics from the ISAC website. This might help patients feel included and informed. In all of this, be aware of how everyone's aphasia differs. Someone might actually be able to fully understand you, but not communicate back, or someone might be able to respond well, but actually did not understand what you said. To make sure you and the patient understand each other, it is advised to continuously check in with them. If you're feeling nervous or unsure how to proceed, you can try asking questions you already know the answer to. This can help get things going. Effective communication is a human right, and for people with aphasia, it's crucial for fair, quality healthcare. Training and small adaptations in your communication style can make a world of difference. Remember, communicate, don't exclude the patient. Use practical tips and strategies. Everyone is different, no one size fits all. Your patients don't need perfect communication, just effort, respect, and a bit of patience. Take the time to find what works together. Even with limited time, a little change can make a big impact. Time is up. We won't keep you any longer. Do you have more time or want to learn more? Trainings like Contact and Communicare offer practical tools in just a few sessions. Ask your facility about availability, or visit fscnet.nl for tools, trainings, and more.